Good afternoon and welcome to another webinar. My name is Dr. Ken Stewart and I'll be your presenter for today. During this webinar, if you have any questions, you can jot it down and save to the end. After the presentation, I will answer any questions you may have regarding this topic. So, let's get started. We often hear about ways to prevent heart disease, cancer, osteoporosis, or viral infections. But what about preventing something as simple as falling? During this webinar, we will be talking about some general statistics about falls among older adults, factors that are associated with falling, ways to create a safe zone in your home, simple exercises you can incorporate into your daily schedule, and your goal or plan for the next 2 weeks. Statistics. The leading cause of injuries in older adults is falling. Falls can lead to loss of independence, early admission into long-term care facilities, disability, and even death. Falls are the leading cause of fatal injuries in older adults. 1 out of every 3 people 65 years and older fall each year. And once they have fallen, they are 2 to 3 times more likely to fall again. In 2012, 2.4 million adults went to the ER due to a fall, and over 722,000 of those patients were hospitalized. Risk. Unfortunately, as our population ages, this problem is not going away. Little by little, it gets harder to pick up your feet or balance on one leg, which is a big concern. These gradual changes are hard to notice until the person falls. I would like to bring to your attention 2 groups of concern or concerns that you should be aware of. Concern number 1, concerns in the home or our surroundings. Threats such as objects that can trip us up or make us lose our footing are all around us. Examples are stairs, throw rugs, slippery bathtubs, concrete curbs in parking lots, tree roots, and even pets. Concern 2, concern with meds. Besides conditions in the homes and communities, older adults' medications can increase risk of falling, and drugs for high blood pressure, depression, and anxiety can cause dizziness, confusion, and poor concentration, resulting in falls. How can we create a safe zone to reduce your risk of falling? Here are a couple of tips. Clear the gutter. Get a friend or family member to help you clean your walkways or anything you can trip over. Phone cords, electric wires, pet bowls, and other things that can cause trouble. Move it out of the way or think of getting rid of it. Light it up. As you get older, you need more light to see. So, Make sure your light switches are easy to reach. Always know where your flashlights are in case of power outage. Hold the rails. If you have stairways, put handrails on both sides of them and put treads on each step. Go down slowly, and if you're carrying anything, make sure you can see each step. Cut the skids. Use self-adhesive non-skid mats or safety treads in bathtubs, showers, and pools. Wear sturdy shoes, inside and outside. Solid footwear helps you balance. Avoid slippers or walking bare feet. Simple exercises can help. It can help strengthen the muscles in your legs and lower body, as well as improve balance and flexibility. Those exercises can be walking, cycling, climbing stairs, stretching, and swimming. So, for the next 2 weeks, what is your plan? What will your plan be? What are you going to do to help reduce your risk of falling? Are you going to use non-slip mats, install grab bars, exercise? Are you going to talk to your doctor about your side effects or the side effects that may arise from taking the medication? Are you going to declutter your walkway? What are you going to do? Are you going to do all of what I just mentioned or a couple? What are you going to do? So I'm going to give you a couple seconds to jot down what you would like to focus on as you find ways to reduce your risk of falls. This brings us to the end of the webinar, and now I'm going to open the floor to answer any questions that you may have. Feel free to type your question using the Go To Webinar tab on the side for questions, and just type it in, and I'll get it in real time, and I can answer that question. So I'm going to give you some time to do that.